Hello, 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 and welcome back. This is the part 2 to your Uno. This is the Q&A episode. We were congratulating ourselves because we kept the methane episode kind of short, a quick hour and 15, which is pretty prompt for us. We're pretty proud, and we have enough time to answer some of your questions from the YouTube channel. So we're going to get right into a few. To start us off, let's get right into a question from the detoxification episode. Cheryl asks, I've been trying to use bone broth daily for detoxification, nutrition, to heal the gut, and help calm inflammation. Have you ever used LDN to help autoimmune conditions? Does LDN help heal the gut? So that's kind of two questions. I will let you answer the first one, and then if I may, I can answer the LDN question. How about that?
For
Divide
sure.
and conquer.
Yeah, so again, I think that bone broth is a perfectly legitimate thing to try. It and can be helpful for detoxification. It has a lot of glycine in it, which can be helpful for phase 2 detoxification and things like that. I don't think it's the end-all be-all. There's certainly other factors that are helpful for detoxification. So you might want to look into things like B vitamins, magnesium, those sorts of things that are key for detoxification. Even glutathione, again, can be another big one. So it's not harmful to try if you feel like you're tolerating it and you're enjoying drinking it, then you can certainly keep drinking it. And it can support detoxification. It's just not the end-all be-all. And do you have a follow-up too on the bone broth?
Yeah, I was just going to say, like, also have a little bit of your mind open to the idea that, like, if it's not helping you, like, if you don't feel like it's doing anything profound, then I don't think you need to consume it every single day. But if you're like, oh my God, my gut feels amazing when I do this, and I feel like it's a really good thing, totally, you have my blessing, you can go for it. But, like, the time and the energy that you put into preparing the bone broth and drinking the bone broth and, like, making it a thing might be better spent somewhere else potentially. Daily might be more than what you need to be doing, although I would lead with however your body's feeling. And then for the LDN, neither of us are prescribers, so neither of us have prescribed LDN. I have worked with a couple of patients who were prescribed LDN from another physician. Some people, it was a little bit rocky getting on it because, like, just the process of getting started with it, they didn't really tolerate it in the beginning. Some people, it's been helpful. I would say, to the best of my knowledge, I don't think that LDN helps heal, like, leaky gut, if that's the question, but it does promote motility, and it can be useful as a prokinetic for some people. So if you have SIBO and your motility is kind of going out the window, then yeah, maybe. For the anti-inflammatory angle of it, maybe, but I think there's probably better ways to go about it than LDN a lot of the time. I usually try to do natural stuff first. Not that I'm intrinsically anti-pharmaceuticals, but usually there's better ways to go about that than just doing LDN. So hopefully that is helpful. Next up, because we've got a lot of questions here, from the Betaine HCl episode, Baxter asks, thank you for uploading this. I'm planning on trying the HCl challenge just to see if it can help alleviate my symptoms I've had chronically for a year now. Not a single okay-looking stool since March of 2020, indigestion, malabsorption, bloat to the point of looking pregnant, fatigue, all symptoms chronically. The doctor's hinting at IBS, but I feel like this is way beyond IBS as it's chronic. Well, I would argue part of the diagnostic criteria for IBS is that it's chronic. What is it? Like, Rome criteria is like more than 3 months in duration.
Yeah.
So automatically that makes it more likely to be IBS. We did various tests and CT scans, no gastroscopy, and everything came out negative. I'm heavily suspecting low stomach acid now. To the question, can HCl capsules aid in recovering from low stomach acid, or is it merely a diagnostic test? If I take it, could it perhaps help my body know how much acid it should produce, or similar, and basically help with the recovery, or is it just see if you're suffering from low stomach acid? If it can't help much as a remedy, any idea of what can? Thank you so much for uploading this. Very informative. Oh, well, you're welcome, first of all. You wanted to take this one, or shall I?
I'll I'll take part of it. I think there were kind of multiple questions in there, so what I don't answer, you can fill in the gaps. But
perfect.
Yeah, I think in terms of the HCL challenge, it's one of those things too where it's like, again, I think we've talked about this before. Like, if someone's getting up to like the 8-9 capsules and they're not getting any burning, like if that's necessarily, like, some people don't want to take 9 capsules with each meal. That's not the goal of the HCL challenge, is to just like be like, oh, for the rest of my life I'm going to be on 10 capsules of HCL per meal. I think whenever there's low stomach acid, you still need to figure out what mechanisms lowering the stomach acid. I mean, that would be like first and foremost. Even if you did the HCL challenge and you found out, oh, my stomach acid's low, I would still try to figure out the mechanism that's driving the low stomach acid so that you can work on that. I do think HCL can be a helpful tool to supplement and support acid. And I think it's one of those things where you can use it as a tool to support, but being on 10 capsules of HCL isn't usually a logistical thing that people want to deal with. So again, I usually would advise people to continue to look at the root causal issues of what could be driving it, but you can certainly use HCL to support the situation in the meantime while you're working on the root causal issues.
Yeah. I mean, it's a Band-Aid, but it's a worthwhile Band-Aid.
Right.
Like, if it's helping you in the meantime while you're juggling the fact that you don't chew, or the fact that you're zinc deficient, or, you know, the gut-brain axis kind of stuff, the vagus nerve stuff, like, while you're kind of teasing that out, you could use the betaine HCL as a Band-Aid for symptomatic relief. It sounds like with everything you described, it sounds like you probably have more going on than just low stomach acid. Like, It sounds like there's a lot of things that are kind of folding into the mix here. IBS, again, could be part of the picture. IBS is inherently a chronic condition. But if you go back to, what was it, like episode number 2, we talked about, well, the title, the diagnosis of IBS actually doesn't tell you anything, really. So, you know, I think IBS sounds like an appropriate diagnosis, but the cause of that IBS is still very much up for grabs, if that makes sense. So I think still digging back to the root causes, but yeah, see if betaine HCL is helpful in the meantime. This is from our All About SIBO episode. Bree says, hi, Bree. We got to speak with her. Hello, ladies. Absolutely loving your thoughts on SIBO treatment. As a provider, I'm keen to learn more about the approaches that fall outside of the traditional protocols, kill, repeat. Any suggestions on where I could go to build my practice knowledge? Ooh. Well, I know I've actually emailed Bree a little bit personally about this, but a couple of my favorites. I've liked Datis Karazian stuff for a while, and he has new ones coming out. I really like Jason Hawryluk, the probiotic advisor guy. We have discussed before our mutual love of, oh God, why can't I think of her name? We keep saying we want her. Thank you, Lucy Mailing. I mean, I really like going to conferences with herbalists. Personally, I feel like I learn a lot more with herbalists than I do with functional medicine conferences personally at this point. I mean, those are some of my favorites. How about you, Amy? Anything that stands out?
Yeah, I would agree. I like all of those. One that I do like, his blog, is the Hack Your Gut with Dave Mayo. He has some good stuff, and he tends to highlight a lot of the newer research that's coming out. It's pretty circadian rhythm focused, but I do tend to like his stuff. But yeah, I think it's hard to find, like, I think there's a few and far between not doing the kill repeat scenario. Like, there's so many people that are doing protocols and all that jazz, and not necessarily thinking super outside the box. So I think, like, we really like the people that tend to think outside the box. Like, again, we fangirl on about them. So again, I agree with everyone you said. Dave Mayo's one that I tend to really like as well.
Yeah, and I follow his stuff too. I forgot about him. There's also this really hip chick named Amy Hohnkamp, and I follow her on Instagram, and she's pretty boss too.
Hey.
And for those of you who don't know, I have a totally separate YouTube channel called Triangle Holistic Gut Health.
Oh, yeah.
And that's where I like indulge in my nerddom, and I get to do these big long videos over explaining things. So that maybe is useful as well.
For sure.
Let's see. All right.
I didn't know that we were allowed to promote ourselves, but I'm glad that you promoted.
Shit. It's our podcast. Why not?
I know. But
I promote you. I promote me. We'll promote everything.
Right. I wish I could have promoted you. That's what I'm saying, you know?
Oh, hey. That's all right. Another time, sweetness. Another time.
You're like, move on.
We've got questions, Amy.
Okay.
All right.
Okay.
All right. This one comes from Genevieve. It's the SIBO root cause episode. She says, "Hi. Thank you for your podcast. Really like your information. A breath of fresh air from all the SIBO world information." You're so welcome. "I've been following for years now. You and Dr. Ben Lynch are talking about the importance of bile as an antimicrobial agent in your body. But I remember Dr. Haverlack saying in a course that bile acid supplements act like an anti-prebiotic and that many Bacteroides and some proteobacteria members are bile acid consumers. What are your opinions about that? And is there a way to optimize our bile flow than others?" Maybe I misread that last sentence, but I think we got the gist. It is interesting because I do think that bile could be really important, and to the point of SIBO specifically, most of what I've seen seems to indicate that the SIBO, the overgrowth, tends to be proteobacteria. And you're correct. Some of the proteobacteria, like bile, and some of the Bacteroides as well. I don't know. It might just be that there's some cross-feeding relationships that we don't really understand completely yet. Like maybe they consume bile and then that makes another compound that can be helpful in some way. I don't know if I fully understand. It's a really good question. I wish I had a better answer for it. How about you, Amy? Do you have any 2 cents?
It's funny because I've thought about this before. I've actually heard some practitioners discussing this before. It might have been a podcast of some sort, but yeah, I think there's definitely scenarios where I've seen that working on increasing bile flow has been very helpful. So yeah, I think that it's a very interesting question, and I do think bile can be a really important factor in the mix. And I'm wondering too, like, if there might be like a circadian rhythm factor with bile flow and things like that, like if it's timed properly, if your meal timings are, like, I think there's a lot of different factors involved than just like bile's either good or bad, like we've discussed on a lot of different topics. But yeah, I don't necessarily have a really like keen answer there, like what you're saying, but I still think bile can be a beneficial you need bile of some sort to digest fat, so it's not a good or bad thing. It might just be like, is it balanced? Is it timed properly? Those sorts of things.
Yeah, and keep in mind that bile is going to be released from the gallbladder after the acidic bolus of food gets dumped into the small bowel. So like some people might have bile issues that go back to low stomach acid, and then that goes back to vagus nerve stuff. Like you can really make this quite a tangled web if you work hard enough at it. So it could just be, I think that regardless, if you do have a bile flow problem, probably the be all end all answer is not to just take like bile acid factors and be done with it.
Yeah.
It's probably like, especially if you have a gallbladder still, there's more that could be done than just taking a supplement and calling it a day.
Right.
But yeah, it's a very good question. I wish I had a better answer for you, but hopefully that helped a little bit.
Right. And one other thing I would add too is that a lot of the prokinetics also have bile, like pro-bile factors to them. So like,
artichoke.
Right. So again, it's an interesting it's an interesting thing just to throw out there that a lot of the prokinetics that I feel like are helpful generally seem to help. Not all the time. And it makes you wonder, again, like maybe there's an imbalance of bile flow in those cases. Total theory, but yeah, I will throw that out there too.
No, I think it's valid. All right. This comes from Claudine. This is from the under eating episode. For SIBO, a lot of us do intermittent fasting, so we have longer cycles of MMC. Isn't that supposed to increase motility? Or can that be bad if you aren't getting enough calories in the eating window time? I think you hit the nail on the head already, Claudine.
Yeah.
If you do intermittent fasting and you are also eating like little meals that are like 300 calories, you're not going to get enough nutrition. If you do IF, you have to make your meals bigger. Otherwise, you're just not going to get the calories you need. I mean, that was my first thought. But what about you, registered dietitian among us?
So I will say generally, personally, I think overall nutrition comes before fasting, like in terms of priority. Like thinking of it, I think sometimes in the SIBO space, we get priorities all tangled up, like fasting, something that we talk about often, but like getting enough calories isn't necessarily talked about in a way that it feels like it's such a high priority. But from my standpoint, getting enough calories in is superior than fasting in terms of how it's going to affect your function. So typically if I have someone, even if they're fasting, if they're still not getting calories in, I might work on getting their calories up and then we can try fasting again. And maybe we try to keep it to like as limited as we can be from like an eating frequency standpoint, but still like usually what I'll do is try to meet needs and then we can reorganize how the eating pattern, so to speak.
I think another point too, and we'll have to do a whole episode on like IF and fasting, because I'm actually a huge fan of like prolonged fasting for my own health.
Yeah.
But another thing that comes to mind too is like, I think that the current popularity of intermittent fasting specifically might be beyond, it might be exaggerated a bit right now. And I feel like it's the swinging of the pendulum that you see with nutritional advice. Like, all right, in the 80s, fat was evil and bad and horrible and other adjectives that mean the same thing. And then now we have keto. Everybody eat fat all the time. Right. Give it another 30 years and then we'll go, fat is bad again.
Right.
And it's just like this back and forth thing. And similarly, I don't know about you, but when I was in school, I remember in undergrad and grad school, and even in some functional medicine seminars, like I remember Karazian talking about this, saying you need to eat 6 small meals a day because it stokes your metabolism and it keeps your metabolism going and yada, yada, yada. And that was the nutritional dogma for a lot of years of this bullshit of 6 small meals a day. So I think that this intermittent fasting popularity right now, and again, like I'm a big, big fan of actual fasting and I'm a moderately big fan of IF, but like I think it's just like the pendulum swinging aggressively to the other side, where like there's probably a lot of people doing IF that don't truly need to do it. You probably just need to eat 3 meals a day and just be done with it.
Right.
And you don't even need to worry about like the time restricted eating window and all of that stuff, unless you're like blatantly insulin resistant or, you know, dealing with something in that realm. But like, I don't know if a lot of people truly need to do IF specifically for gut health. I think like you can just eat breakfast, lunch, and dinner and not snack in between and not have anything after dinner and your gut will be pretty happy with that.
Right.
So
I agree. And I think that like one thing of note specifically about like under eating and fasting, like fasting can be done in a way like what you're saying, if you're kind of like, oh, I'm just cutting out a meal and not replacing it. Like I find that a lot of people do like, oh, I'm eating 2 meals a day, but they don't do anything to replace calories that were lost at breakfast. Like I think the thing that's powerful about fasting is like you're in either a deficit or maybe a restrictive time period of eating. But then like at some point you break that fast. If you're constantly fasted, like if you're constantly under eating, you're basically constantly in a fast. So your body's going to be more constantly stressed.
Yeah.
So that's something to keep in mind too. And I think you're right. Like, fasting, there's a lot of dogma around it, I feel like, at this point. Like, what does fasting look like? Is it 16-8? Like, they can get really kind of intense about it. And I think, knowing that you might need to experiment with it to figure out what that looks like for you. Again, for a lot of people, it's just 3 meals a day without eating snacks. And then again, some people, it might be like a 14, what would that be, 14-10 or something like that, where maybe they don't do a full 16 hours, but 14 hours feels really good to them. So there's some variability even with fasting, and sometimes figuring out what seems to work best for you might take some tweaking and experimentation.
Yeah. I think that you already hit the nail on the head in the beginning, though, when you said getting enough nutrition is number one. And then if you can do some variation of fasting or IF after you meet your nutritional needs, and while that is still humming in the background, then cool for you. But if you're getting to a point where it's one or the other, you've got to prioritize getting nutrition in your body, because you're not going to heal anything if you're not adequately nourished.
Right.
End of story. Okay, this is also from the under-eating episode. AY asks, have you ever discussed the effects of butyric acid for gut and brain and supplements of it versus food, etc.? Honestly, I feel like we should do an entire episode about short-chain fatty acids. So I'm going to suggest that we table this one for the moment, because we are going to eventually do a whole episode. I would say, just really quickly, the food versus supplements. If you're trying to get butyric acid from ghee or butter, I think that probably is not going to be super effective, because that's that was one of the big things with paleo, right? In the beginning, where it's butyric acid, it's good for your gut and your brain. It's but how much are you really getting?
Right.
So I don't know about the food thing, but you can eat prebiotics and encourage your microbiome to make its own butyrate, and that's really rad. But otherwise, I'm going to table that conversation, because we're going to eventually do a whole episode on short-chain fatty acids, of which one of those is butyrate. So hang tight, AY. But that's a good question. Just not you're half a step ahead of us. That's all. This one is from the detox episode. This comes from Jomi. Dr. Daneza, thanks for this video. You're welcome, but also you should be thanking Amy. No, I'm kidding.
It's okay. You can thank Dr. Daneza.
What should I take to detox from SIBO/SIFO? I was thinking of using probiotics. Thanks. I don't know if I fully understand the question. Detoxing from SIBO versus treating SIBO, and how probiotics fill that need. I think that there's a couple of things we could unpack there, but I'm not entirely sure I'm clear on the question. So Jomi, if you could reach out to us or comment on the YouTube channel again, I'd be curious for you to flesh that one out a little bit more, because I'm not 100% clear what you're going after there. I think you're basically asking how to treat SIBO and SIFO. But I'm not 100% sure of that. Okay. Next up, the post-infectious IBS episode. Beth asks, if someone has post-infectious IBS, does one have to accept chronic SIBO, or can they still get it into remission? Oh, Lord, no, Beth. You can get it into remission. The thing is, you just have to work that much harder on motility and the vagus nerve and managing your stress and your sleep and all of that stuff. Whereas somebody who got SIBO because they took a PPI, it's just get off the PPI and make sure you're chewing your food and treat the SIBO, and then you're probably skipping off into the rainbows. With post-infectious IBS, you just have to really, really, really be super, super keen on working on motility and building up those neurons again, and making sure that you never get thrown into the gutter by food poisoning again. But no, you can definitely get rid of SIBO. I've worked with a lot of patients with post-infectious IBS, and they are not all chronic SIBO sufferers. The vast majority of them, we have put their SIBO into remission or cure, or whatever you want to talk about it. Sorry, I didn't ask you your opinion, Amy.
No, I think you said everything. And I know we talked about on that episode too, just that prokinetics can be more
Huge.
Like very more important on a long-term basis.
Yeah. Big biggies. Same episode, the post-infectious IBS episode. Have you seen infection from eating bad sourdough yeast starter? I know that's specific, but I'm trying to figure out if my IBS cause officially diagnosed with ulcerative procolitis. Mesalamine and steroids have not helped at all. Interesting. I have not heard of that, Amit, but I could say maybe. What you'd want to do, I would think, is get one of those post-infectious IBS blood tests done that looks at the antivinculin antibodies. And then that would be able to show you if you have those antibodies elevated, then yes, you could be reasonably sure that that was your mechanism, or it's a mechanism. If those antibodies are negative, then I probably wouldn't think about it quite as much. It would be more of like a week maybe in that case. Have you ever heard of anybody getting like food poisoning from a bad sourdough starter?
I have not. Yeah, that's one I don't necessarily have tons to add on.
Okay. We'll do one more quick one, and then Amy's got to hop off for another call. All right. From the low stomach acid and PPI episode, Nikki asks, is localized pelvic pain, lower left pelvic pain, seen in your practice with SIBO patients? Not lower left so much. I mean, you could certainly have pain. Honestly, that would be something that I would probably refer to like a pelvic floor physical therapist.
Yeah.
And see how far that goes. And actually, I just came across a study that pelvic floor PT was helpful for constipation in a lot of patients. I forget the numbers, but that's actually something I want to explore on the podcast coming up. Yeah, I would probably do pelvic floor physical therapy first, maybe with biofeedback. I've certainly seen a lot of lower right-hand side pain with SIBO, and I've seen a lot of like mid-gut pain, like around the belly button. I can think of a couple of patients where it was more localized to the lower left, like kind of in front of the hip pointer bone or between the hip pointer bone and the belly button, but I don't think that's quite as common from purely SIBO. I think there's probably something else going on that you want to work on, like maybe the pelvic floor muscles themselves. What do you think, Amy?
Yeah, I agree. I think that, PT could have a number of relevance or a number of areas that it could be helpful for from a SIBO standpoint. And I often wonder too, like with things like endometriosis and like certain scenarios where PT might be even more important if there's like adhesions and things that could be more attributed to the pain in the pelvic area, where a PT might be helpful in that area. But yeah, I think there are times like where like lower left quadrant could be related to things like constipation or like colonic issues, but not necessarily SIBO. Yeah.
Again, like the body is pretty crappy, pun intended, at perceiving where our pain is coming from, if it's coming from the abdomen or the organs. So you never quite know if the area that you're like pointing to where you have pain is really where the organ is causing pain.
Right.
But yeah, I would tend to think more like colon, pelvic floor muscles, maybe even ovary. In women, like it could be an ovary that's giving you a hard time. But I might not think, even endometriosis, if you have endometrial tissue outside of the uterus, you could have an endometriosis chunk, for lack of a better word, that's floating out over by the sigmoid colon or the left side of the colon, certainly. So all hats are off with endometriosis as well. So, yeah. Well, guys, we actually have quite a few more cues to get to, but I'm going to let Amy skedaddle for the moment because she has another call with somebody else. I'm going to try not to be too bent out of shape about that. But we will continue to do a Q&A episode every now and then, and we'll try to get to all of your cues because there's quite a few of them. So thank you so much for submitting that. And Amy, I will talk to you next time. As always, guys, please do subscribe, leave comments, leave, the thumbs up, the bell, whatever you do on whatever platform you're at, and we would be happy if you said hello and left us your cues, and we will happily provide A's. So Amy, until next time, 'twas a pleasure, my dear. I will see you next week.